Well, the money is going to come whatever happens in terms of Brexit. Obviously, we can put this money into the NHS because we have a strong economy. We haven't had to put taxes up because there are more jobs and record numbers of jobs, so more people paying tax. And that means we've been able to fund it, but it's guaranteed in all Brexit scenarios.
You wouldn't go as far as the PM did today, saying that this is being paid for by the very act of leaving the EU, would you?
Well, of course, the money that we directly pay to the EU won't have to be paid after leaving. So in that sense, yes, absolutely. But crucially, the £20.5 billion is guaranteed for the NHS. It's what the NHS needs, and the job of the NHS and the health department is to make sure that it's spent as effectively as possible, keeping people healthy, and with a real focus on prevention as well as, of course, the cure.
You can only do that, of course, if you have the staff in place. We know that 60,000 NHS staff come from the EU. You've got a recruitment crisis of some 20,000 vacancies. How do you manage to put this plan in place then?
Well, of course, when you put £20 billion into a public service, we are going to need more people to do the jobs. We're going to train more people here at home. We've got a 50% increase in the clinical placements for nurses. Of course we need more nurses, absolutely, and so there's a lot of work going into how we deliver on that. We'll continue to welcome people from around the world, both the EU and outside the EU. Actually, in the NHS at the moment, there's more people from outside the EU working in the NHS than from the EU. But the immigration white paper set out by the Home Secretary at the end of last year allows for the recruitment of people where we have a shortage occupation.
OK, you told Newsnight that you had become the biggest buyer of fridges. Have you got enough fridges yet?
That's ongoing. We haven't completed the build and the procurement, but the contracts are signed, and so that's in hand and it's on track for the end of March. The big picture here in terms of buying fridges is that we need to make sure, even though I don't want to see no deal, and no deal would be a mistake, we need to make sure we're prepared for all eventualities.
Just give me the details then. How many fridges have you bought? What is the number that makes you the biggest number?
We have contracts in place for 5,000. And these are big, industrial refrigeration units. And what matters is that it will make sure that we have the capacity alongside work with the pharmaceutical industry.
So where are those fridges? Are they in the UK?
Of course, yes.
So have we paid for them already?
Yes.
So we've paid for 5,000 fridges, whether or not we have no deal?
Yes, and the reason we've done that is that we, in the health department, pay for contingencies for an awful lot of things that we don't want to happen.
You would accept, though, that the only sight of a majority in the Commons at this moment is on preventing no deal, and yet this government is spending billions on the preparations for no deal. That's a massive waste.
Well, in this case, the refrigeration capacity is a contract that's just over £10 million. I need to be able to look myself in the mirror and say that I have done what is necessary to prepare for all eventualities. And unless this Parliament and the House of Commons votes for an alternative deal, and the only deal on the table is the Prime Minister's, unless it votes for the Prime Minister's deal, then the law of the land says we end up at no deal. And in your question, you gave the game away when you said that the only thing that the Parliament we know is likely to vote against. Well, likely isn't good enough for me as Health Secretary when I'm talking about people's lives in terms of their access to medicine.
Well, you've already seen Margot James become the first minister today to suggest that Article 50 could be extended. Now, the government could just go along with that. Would you support an extension to Article 50 now? I
think that the best option is to vote for the Prime Minister's deal. And I know that's the government position, but I feel it very strongly. And the reason is that there's only the alternatives, either of no deal that we've been talking about with all the downsides that it has, or of a second referendum, which would be hugely divisive and actually wouldn't settle the question, These are not good options at all. Now, I think the deal is a good one. And I think it's a good one because it delivers a close economic relationship whilst delivering on the result of the referendum.
We've seen other contingency planning today, as you'll know, the lorry emergency dry run. I wonder if that has put your mind at rest.
Well, of course, we rely on the logistics to get medicines around, so it's very important that the logistical operations work. But one of the reasons that we have already put in place a stockpiling operation amongst the pharmaceutical companies is in case there's a blockage at the border.
Right, but you'll accept that that was a bit of a farce, that whole dry run today, that Dover deals with 4,000 lorries a day and we saw 89. I don't know whether you want the message to be that we can cope or that we can't cope.
Well, I want the message to be that the Department for Health and the NHS are doing what is necessary to make sure there's an unhindered supply of medicines.
We've now had that date of the vote confirmed for next Tuesday. I'm wondering if anyone that you've spoken to, any colleague, has changed their mind about the vote since it was cancelled last time round?
Well, look, clearly the vote is tight and the whips are working away. And my sense, going back to Suffolk for a couple of weeks at Christmas, is that people want us to get on with it. And that's the very strong sense of the country, and the deal on the table is the best way to deliver that.
Just before you go, one of your colleagues, Anna Soubry, Conservative MP, called a Nazi today as she was speaking on College Green. There was chanting, she was called scum, she was followed. I wonder if you think that action should be taken against protesters?
Well, I certainly think that the police need to look at this one very, very closely indeed, and look at the way that MPs are treated, in particular female MPs actually, and Anna has been subject to a lot of it. She's unbelievable in terms of her response.
Do you think, or do you fear it will be a deterrent to other MPs as they go about their jobs openly, publicly in Westminster?
Well, it absolutely mustn't be. You know, the way that Anna's respond to it is a tribute to her, but we've got to make sure that MPs and indeed all of us can make these arguments about the future of our country, which people feel very strongly, and even if they disagree in a reasonable and a civilised way. It's absolutely vital that we solve that problem. And if that means measures by the police, then I'd be all in favour of them.
Thank you very much.